Her name was Barbara. She was 71 years old, terminal lung cancer with bone metastasis. Stage 4, inoperable. Her oncologist told her she had 3 to 6 months. There was no cure. There was no treatment that would extend her life. The only thing medicine could offer her was comfort. The only thing she needed was pain control. Her doctor prescribed liquid morphine, 30 milligrams every 2 hours, the standard protocol for terminal cancer pain. Medicare Advantage denied it as not medically necessary. Barbara died 11 days later. Those 11 days were spent in severe, uncontrolled pain that never should have happened. Barbara had been a middle school math teacher for 37 years. She was the teacher kids remembered decades later, the one who stayed after school to help students who were struggling, the one who paid for supplies out of her own pocket, the one who showed up to her students' games and plays and graduations. She retired in 2022. She had plans. She wanted to visit national parks. She wanted to spend time with her grandchildren. She wanted to read all the books she'd never had time for. Instead, she got 18 months of retirement before the diagnosis came. July of 2025. She'd been feeling tired. She had a cough that wouldn't go away. Her primary care doctor ordered a chest X-ray. The X-ray showed a mass. The CT scan confirmed it. Lung cancer, advanced stage. It had already spread to her spine, her ribs, her pelvis. The oncologist sat with Barbara and her daughter and explained what this meant. There was no surgery that would help. Chemotherapy might buy a few weeks, but would make her sicker. The best option was hospice care. Keep her comfortable. Manage her pain. Let her spend whatever time she had left with her family, not in a hospital. Barbara chose hospice. She wanted to be home. She wanted to see her garden. She wanted her grandchildren to visit without being scared by hospital machines. Her doctor enrolled her in home hospice care and wrote prescriptions for everything she would need. Anti-nausea medication, anti-anxiety medication, and morphine for pain control. Cancer that spreads to bone causes severe pain. It's constant. It doesn't respond to over-the-counter medications. It requires opioid pain management. This is standard. This is what every palliative care physician in the country prescribes. This is what allows terminal patients to have quality of life in their final weeks. The morphine prescription was submitted to her Medicare Advantage plan for prior authorization. It was marked urgent. It included her diagnosis, her staging, her prognosis, and documentation from her oncologist and her hospice physician, both stating this was medically necessary for terminal cancer pain. The first denial came back in 36 hours. The reason given was, exceeds dosage guidelines. Barbara's hospice nurse called the insurance company. The dosage prescribed was standard for someone with metastatic bone cancer. The representative said the medical review team had determined the dosage was too high and she should try a lower dose first. Her doctor resubmitted with a lower dosage, knowing it wouldn't be enough, but hoping to get partial approval they could appeal later. Second denial. This time the reason was, try acetaminophen first, Tylenol. They wanted a woman with terminal cancer eating through her bones to try Tylenol first. Her daughter couldn't believe what she was reading. She called the number on the denial letter. She explained her mother was dying. She explained this was hospice care. The representative said the policy required patients to try non-opioid pain management before approving opioid medications. Third denial. Patient must fail gabapentin and lidocaine patches first. Gabapentin is a nerve pain medication. Lidocaine patches are topical numbing agents. Neither is appropriate for severe cancer pain. Her hospice physician wrote a letter explaining this. He explained that making a terminal patient wait to fail inappropriate medications was cruel and not evidence-based medicine. He explained that every day without adequate pain control was a day of unnecessary suffering. He submitted the appeal with citations from palliative care guidelines. Fourth denial. Step therapy required. Must try 3 cheaper medications first. Step therapy is a policy where insurance companies require patients to try and fail cheaper drugs before approving more expensive ones. It's controversial even for chronic conditions. For terminal patients, it's unconscionable. Barbara didn't have time to try and fail 3 medications. She had weeks to live. Her doctor submitted an exception request. He stated clearly this was a hospice patient with a terminal diagnosis who needed immediate pain control. 5th and final denial. Morphine not medically necessary for terminal cancer pain. Her daughter read that sentence 10 times, trying to make it mean something different. Not medically necessary. Her mother had cancer in her bones, and they were saying pain medication wasn't medically necessary. She called the insurance company. She asked to speak to the medical reviewer who made that determination. She was told it wasn't possible. She asked what her mother was supposed to do for pain. The representative suggested she discuss alternatives with her physician. During those 11 days, Barbara's hospice nurse did everything she could with what she was allowed to give. Over-the-counter pain relievers that barely touched the pain. Anti-anxiety medication to help her rest. Comfort measures like positioning and ice packs. But none of it was enough. Barbara couldn't sleep for more than 20 minutes at a time. She couldn't find a position that didn't hurt. She couldn't think about anything except the pain. Her daughter stayed with her around the clock. She held her mother's hand. She tried to distract her. She played music. She read aloud. Nothing helped. By day 8, Barbara was too weak to get out of bed. The pain was overwhelming. Her hospice nurse called the oncologist. They discussed admitting her to the hospital, where they could give her 4 pain medication without insurance authorization. But Barbara had chosen home hospice because she didn't want to die in a hospital. Moving her would mean giving up the one thing she'd asked for. Her daughter didn't know what to do. Let her mother suffer at home or force her into a hospital against her wishes. On day 11, Barbara's breathing changed. The hospice nurse recognized what was happening. Her body was shutting down. Her daughter called her brother and her grandchildren. They came to say goodbye. Barbara died at 4:17 in the morning with her family around her. The hospice nurse marked the time. She filled out the paperwork. She was professional and compassionate. After the family left the room, she sat in her car and cried. She'd been a hospice nurse for 16 years. She'd never seen anyone denied morphine for terminal cancer pain before. Not once, until this year. This is not an isolated case. Across the country, hospice patients are being subjected to prior authorization requirements for pain medication. Terminal cancer patients are being told to try Tylenol first. Dying patients are being forced into step therapy protocols designed for chronic conditions, not end-of-life care. Medicare Advantage plans are applying the same cost-cutting measures to hospice care that they apply to everything else. Every morphine prescription they deny saves money. Every prior authorization that delays treatment reduces their costs. The fact that this causes unnecessary suffering to dying patients doesn't appear in their cost-benefit analysis. Barbara's daughter filed a complaint with the State Insurance Commission. She wrote to her congressional representative. She contacted patient advocacy organizations. She did everything she could to make sure what happened to her mother wouldn't happen to anyone else. 6 months later, nothing has changed. The insurance company is still operating. They're still requiring prior authorization for hospice medications. They're still denying morphine as not medically necessary for terminal cancer patients. If your mother, your father, your spouse, anyone you love is in hospice care or facing a terminal diagnosis, you need to know this is happening. Prior authorization is being applied to end-of-life care. Insurance companies are second-guessing hospice physicians about what dying patients need. People who should be spending their final days in comfort are spending them in pain because someone in a call center decided their medication was too expensive. These stories need to be told. Every hospice patient denied adequate pain control. Every family that watched their loved ones suffer unnecessarily. Every physician who had to tell their dying patient they couldn't help them because insurance wouldn't approve the medication. Share these experiences. Document them. Make them visible. Complete anonymity is guaranteed. No names unless you choose. No identifying details. Just the truth of what happened. This will continue until enough people understand what's being done in the name of cost management. Until denying morphine to terminal cancer patients becomes more expensive than approving it. Until the outrage exceeds the savings. Right now, someone else is being told to try acetaminophen for bone cancer pain. Someone else's morphine prescription is being denied. Someone else's final days are being filled with preventable suffering. This is the reality of prior authorization in hospice care. Right now, as you finish watching this, another dying mother is being told to try Tylenol for bone cancer pain. Subscribe, because tomorrow it could be yours, and you'll never forgive yourself for not knowing.